Patho. Pharmacology and contraindications. David Merlino, Mblex review. So I divided Patho into 3 sections. It needs to be longer, more sections, but we're going to cram. Because why not? That's what we do in an accelerated program. Why is it not working? There. The overview. Diseases affect body structures or functions. They are associated with signs and symptoms. They are not typically caused by physical trauma, and they're classified by cause, duration, and the origin. So, acute versus chronic diseases, some of the red flags. Acute would be the sudden onset plus the severe symptom. All right. Chronic diseases usually last over 3 months, so it's a longer disease or issue. Some contraindications you should know by now is fever, infection, or if there is an acute flare-up, you might need to either modify or refer out. Do you guys remember how long an acute inflammatory response is?
48 to 72?
Yep. And sometimes it can be longer, but that's average. So 2 to 3 days. So that means if somebody, and this isn't a disease, say somebody had a trauma, a physical trauma, a car accident, we'll say, and they're trying to get the massage in the next day, tell them I would feel more comfortable if we wait about 3 days to make sure there isn't something else going on. There are different types of diseases. Shocker. Yeah. Congenital, which is a disease that's present at birth. An acquired disease, which is typically acquired or obtained after birth, right? Autoimmune diseases. So this is when your immune system is attacking cells and structures in the body and it can't differentiate between good and bad cells. Deficiencies. This is the result of the body not receiving adequate nutrients, like a vitamin D deficiency, which a lot of us have in Ohio during the wintertime. Hereditary. This is inherited from your family, right? Idiopathic. So this is of an unknown cause, right? An infectious would be an invasion of a microorganism, like a bacterial infection, viral, parasitic, fungal. Diseases. Let's talk about autoimmune diseases. Also, I have something really cool to tell you guys later. I'm just going to tell you now while I'm thinking of it. And I'm going to show you my chart. I had a client come in who gave me permission to show you guys my chart. I referred her out because she was having shoulder pain that wasn't getting better. So it is so cool. I did not know that your bone marrow can have edema in it. Did you know that? So her chromium is, the bone marrow inside of it is edematous. So it's causing through her MRI.
Wow.
Yeah.
Never.
So I'm going to...
Where's it? In her shoulder?
Yeah, so she's having... And also... Yeah, and I'll show you it. She's also having rotator cuff issues, which is what I told her. I think you have possible tear, but no tear. There's a lot going on. I'll show you guys that later. I'm going to text myself so I remember. Yeah, and we can we'll look at it and see what you guys think the treatment would be if you were working on her. And I think it's a really cool situation. And I was like, this is so cool for me, but not you. That's what I told her. All right, autoimmune diseases. Let's get back. This is when, like I said, before the immune system attacks healthy tissue. Autoantibodies are produced, and this could affect either the body as a whole or one system. Makes sense? And here's a fun picture that I found on the webs. So here are some common symptoms with somebody with an autoimmune disease, which also autoimmune diseases are kind of tricky to diagnose. So trouble concentrating could be one. They might have a low-grade fever, numbness and tingling in the hands and feet, random skin rashes, swelling and redness in certain areas, fatigue. Those are some symptoms that an autoimmune disease can present. All right. Autoimmune condition, red flags. If there is systemic inflammation, red flag. And if there is an unpredictable flare-up, if you're noticing this, do not work on them and refer out. Contraindications would be avoid deep pressure if there is an active flare-up, or maybe avoid that area depending on what's going on, or modify pressure and duration. All right, here are the infectious pathogens or microorganisms. The main ones are bacteria, virus, fungi, protozoa. And I think we're going to break it down. Yeah, we're going to break it down a little more for each. But here's a fun little chart I found with description and causes. So bacteria is a single-celled organism without a nucleus. Some bacteria would be your streptococcus, staphylococcus, so staph, strep, tuberculosis, food poisoning, and so on. There's a huge list there. Then you have your viruses. These are non-living particles that reproduce by taking over living cells. So they invade the cell and take over, right? This would be your common cold, the flu, COVID, right? Herpes. It says cold, but it's cold sores. Chickenpox, etc. Fungi. These are simple organisms that would be mushrooms and yeasts and grow as single cells or thread like a filament. This would include your ringworm, your athlete's foot, right? Any kind of mushroom poisoning. There's a list. Protozoa, single-celled organisms with a nucleus. So this would be like your malaria, giardia, and stuff like that. Cool? Cool. Hopefully nobody gets a protozoa. Don't drink water in Mexico. Bacterial infections. Breaking it down, baby. Single-celled. Freely and quickly reproduces via mitosis. It's usually caused by an invasion of that bacteria in the body. What happens is the bacteria goes in the body, releases the toxins, and that waste is what causes the reaction in your body. They come in different shapes. Rods, spherical, spirals, there's a bunch of different shapes. And the treatments for bacterial infection would be your antibiotics. And sometimes I have to find which one works best. Questions? Concerns? Viral infection caused by viruses, right? They're smaller than bacteria, so they're sneaky little son of a guns. They contain DNA or RNA in their core. They attach to healthy cells, change the cells, and then reproduce more virus cells, right? There's something called the lytic cycle. There's a typo here. What happens here, and I have to fix this so that's not over the text, but anyhow, this is destruction of the healthy cell and its membrane from the invasion of this virus, right? So that is what that is called when there is an invasion. Alien invasion. So for a virus, we can't treat it with an antibiotic. We have to let it run its course. So you want to treat the symptoms. All right. Different medication, vaccines, whatever. Some viruses lay dormant in the body and then come back out in periods of stress or whatnot. Kind of like a cold sore, right? Parasitic infections. Parasites need a host to survive. Types would be your protozoa, your helminths, and your ectoparasites. The difference between them. Protozoa are single cell. That would be your Giardia, amoebas, coccidia. Sorry, I had to wet my whistle. The helminths would be your, what we call worms, right? Typically you get this from ingesting food containing the larva, or, I would hope you're not just eating a tapeworm, but to each their own. Maybe you're on that, like, Naked and Afraid show and you're really hungry. Just kidding. This would be tapeworms, roundworms, flukes, so on, hookworms. Ectoparasites are attached to the surface of the host, all right, and then they feed off their blood. Think vampire. I'm just kidding. Ticks, mosquitoes, leeches. So the treatment obviously would be to remove this parasite, all right, or anti-parasitic medication. Yum. Fungal infections. It's caused by the fungus coming in contact with the body. You can also get a fungal infection internally, so that's not fun. You can breathe it in, like mold spores and stuff like that. They tend to thrive in warm, dark, humid, toasty conditions. So this would be your ringworm, the athlete's foot, a yeast infection. Treatment would be you can take an internal or a topical antifungal medication. Here's some cool pictures of what might happen if you have a fungal infection. So if you see a weird rash on somebody and you're working on them, don't touch it. Right? So redness and inflammation, that's usually the start of something, right? Your histamine response. You can have itching and irritation or peeling of the skin. Right? A rash. This is a ringworm rash here. Burning sensations, discharge or odor. Hair and nail changes. Cracks and fissures. So it doesn't just mean they have dry skin. They can, sometimes have a fungal infection. So be careful. All right. Red flags are redness, heat, fever, swelling. You guys should have this in the bag, right? Contraindications would be if there's an active infection, no massaging. Refer to a medical provider, right? If something seems a little off. We're doing good. Now we also have to talk about psychological diseases, aka mental diseases, that are hard to pinpoint, all right? They can vary from person to person. One person might have, borderline personality disorder, and there might be two, and they react and act completely different to this disease. So psych disorders are common in children. These ones, ADHD, attachment disorder, stuttering. Side note, if you guys didn't already know, one, I love Ed Sheeran. Love him. He used to stutter as a child, and he used music and rapping and Eminem, he loves Eminem, to get over his stutter. You're welcome for the information.
So did Mel Tillis, the country singer.
Really? And there was a boy on the new season of Idol that has a stutter, but not when he sings.
Yep, that's Mel Tillis.
That's who it is?
No, Mel
Oh.
Tillis did the same thing, that he couldn't talk because he stuttered so badly. So he started singing and then became this famous country star.
Isn't that weird how your brain could be like, when you sing, there is no stutter?
I wonder
I don't know. The brain is awesome. It's so powerful. We only use what fraction of it? Like a little baby bit. Crazy. Anyhow, let's get back to this. So psych disorders that are common in adults would be addiction is a big one. Depression, bipolar, eating disorders, PTSD, and panic disorder. And you have to keep in mind, someone with PTSD, what might be traumatic to you might not be traumatic for somebody else, and vice versa. So everybody handles trauma in a different way. Personality disorders, that would be, there's a lot of personality disorders, but some of them would be antisocial personality disorder, dissociative, did you say me? Identity disorder, obsessive compulsive personality disorder, which isn't the same as just OCD. But there's a lot. If you're interested, take a psych course. Fun fact?
If you actually have like the true anti-social disorder, you know, like become a serial killer.
Really?
That's me.
She's like, do you have pigs?
No.
You need to if you're going to be a serial killer. I'm just kidding. Oh, man. I'm totally getting fired one day. All right. Cells of the immune system. Our immune system's awesome. Immunity is the ability to protect itself, right, from disease and pathogens. When you have an immune response, it's the process of destroying the foreign material that's entering your body. Get rid of that bad boy. All right. Types: humoral immune system and cell-mediated immune system. Humoral takes place in the body's fluids, the humors. This is where the production of antibodies happens. So in this picture, the antibodies are the weird little Y-shaped things. Okay? So what happens is in this system, it neutralizes the pathogen for easier destruction. All right? Then your body remembers these, right? The cell-mediated immune system, this would involve your killer cells, like your killer T cells. Right? This destroys the pathogen but doesn't use antibodies. So your body needs both to kill something, right? It needs these are the soldiers, right? Needs these soldiers to come kill things for you if the antibodies aren't. Types would be your effector, your helper, your cytotoxic, your natural killer cells, memory cells, regulatory cells. Each one has a job. So all of these immune cells have a specific job. Does that make sense? Right? I think it does. All right, so the pathogen detected B or T cells tend to release the cytokines. And these are proteins that communicate to bring more of the B and T cells in. All right? They're like, let's destroy the pathogen. Here's a chart next of the difference between the two. All right, so if we look left, the humoral, this secretes antibodies that defend against the extracellular pathogens, and then the cell-mediated brings in the killer T cells, right? And then they defend against infected cells, cancers, transplant tissues, etc. Cool. Bum, 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 bum. All right, so the phagocytes. These are a type of white blood cell. Right? They gobble up all the cellular debris and those bad guys, the pathogens. There's a bunch of different types of phagocytes. You have your neutrophils, your monocytes, your macrophage, and your dendrite cells. The neutrophils are the first responder. These are your EMS. All right, they release enzymes that destroy the pathogen, and then they start chomping them. Right? The monocytes move from the blood area to the area needed, and then they mature. All right. The monocytes mature into phago or macrophages and dendrite cells. So neutrophils, first responder. Monocytes pulled from the blood, they mature and become macrophage or dendrite. Right? The macrophage, phages with an S, are the cleaners, all right? And they tend to have a longer life than the dendrite cells. The dendrites are the messengers that deliver the precise response. These are the, what's the word I'm looking for? The snipers. All right. So we have something called phagocytosis. What does she want? Cytosis, wow, words, is when the phagocytes get the bacterium, they bring it in, they break it up, and then spit it back out, right? Antibodies. Antibodies are also called immunoglobulin, right? So these are produced and secreted by the B cells. They are the Y-shaped. Remember that picture where I said, these are the antibodies, right? They tend to try to neutralize that pathogen. And they're stored in the body as memory cells. So that's why when we are presented with this disease again, our body knows how to fight it. Different types. I'm not going to go into all the different types because I don't really know about the different types. But there's the IgA, D, E, G, M. I don't know. Bunch of different letters in no specific order. But if you are at all interested in this, you can read up about the different types of antibodies. Yes?
Fun fact.
Let's hear the fun fact.
All of these, I used to hang IG treatments. All of these antibodies, depending on like cancer or whatever someone's got going on, they have IV infusions of these that people get regularly.
That's cool.
Attempt to help.
Do you have separate ones, or is it all like
the only thing that I've ever
a package
heard is
deal?
IgG or IgA. They're
Yeah.
separate. But it's kind of like its own cancer treatment. Like you go get your chemo weekly or this and that.
That's
Some
cool.
people would come in and get IgG treatments.
I feel like this is safer.
Yeah. I worked for an oncologist for about a year.
That's really cool.
Folks get IgG testing when they're born to see if they've gotten enough colostrum. And if
Ooh.
their IgG is low, then
Yeah.
they get a platelet infusion after that to help with their immune system since they didn't get that boost from the colostrum.
Yeah. Isn't the colostrum only in the beginning too, or is it? Yeah.
Like within the first 48 hours.
Liquid gold. Actually, this liquid gold, you can get like a supplement for humans and take colostrum too. Craziness. Cool stuff. Yeah, you can get an IV of these bad boys, according to Carly. Awesome. Let's do it. Field trip. All right, we're going to keep getting through. Tissue repair and healing. So inflammation, we're going to go over inflammation. Inflammation is vital to healing. All right, we need it. There's a process. All right. First process is recognition. This is when things get red or itchy or whatever. This is the histamine response. Then you're going to notice vascular changes. You're going to notice vasodilation. And this is where your heat and your redness and your swelling start. Then you have leukocyte recruitment. These are your immune cells. They move to the area to help clean up the damaged tissue. Right? Destruction. The neutrophils and macrophages engulf the pathogens and the cellular debris to get rid of it so that your body can have all the good cells to heal, right? And then there's repair. This is when the inflammatory response subsides a bit and your healing begins. This is important to healing in general. Here's a fun little picture, if you care, of what acute inflammation is, right? And what Signs of chronic inflammation can include, right? Bunch of stuff. So I'll let you guys, when you're studying these slides, because you're good little students, you can check these out. Healing. The primary intention, there's a primary intention healing, secondary intention, and tertiary intention healing. So the third. That's a dog bite. Zombie bite. It is. Primary intention, damaged area, close together and heal itself. So these are different. This is when you just have a tiny little cut or a paper cut. The edges line up so that it could just kind of heal nicely. All right. So what happens is the wound forms a blood clot. Bleeding stops. The tissue's held together. A scab is formed. Under the scab, things are repaired, and then the scab falls off. Secondary intention. These are wounds that are uneven or far apart. This typically requires granulated tissue to fill the missing tissue. This takes longer to heal. This typically results in a scar. Examples would be ulcers or burns. Tertiary intention. Requires medical intervention, not invention. All right, there's delayed primary closure, so what they're doing is making sure the wound is left open so that it doesn't have an infection in it, right? When the infection is healed, they can go in and kind of clean things up and do what they need to do. This would be like an animal bite or like a really severe wound, something like that, where you're missing a big chunk of tissue. Does that make sense? I hope so. Tissue healing, red flags. If there's redness, swelling, heat, inflammation, or an open wound, it's a red flag, or you might need to modify, right? Do not massage acute injuries. If you're working on scar tissue, you might need to modify some of the massage moves. And also wait till they're cleared and the scar tissue is formed well enough and there's not red or inflammation or pain at the scar before you start doing cross fiber friction to treat the scar. Then we have bone healing. So we had skin healing and muscle healing. Now we're having bone healing, right? So typically what happens with bone regeneration is you have a hematoma formation. Excuse me. My pants keep riding up to my knees. Then you have clotting and inflammation. Step 1. Step 2. You have a fibrocartilage callus forming. So this soft callus replaces the clot so that it can start healing with a firmer type of tissue. Then you have hard callus formation. So this is osteoblast. Remember, blast, bone, B. All right, osteoblasts build the bone, and then the osteoclasts break down the damaged bone to get rid of it so that you have nice, clean bone to replace the injury. Then you have the remodeling phase. The new bone's formed. This can take months to years depending on the injury. And I lost my train of thought, but there you go. I'm crazy. All right, scars. Our body can have all kinds of different types of scars, and we're going to go over a bunch of different ones. These are fun. So the first one is acne scars. All right. Obviously, this is present in a person who has had severe acne or still does, right? It can leave deep pits in the skin. So what happens is the follicle wall is broken down, sometimes from excessive oil, bacteria, or fluid. Then it leaves that crater, as you would call it, or scar. Then we have our contracture scar. Often it's from a severe burn. It may extend deeper than skin and affect muscle, nerves, right? And a contracture scar can actually affect the mobility in that area. All right. Now we have a keloid scar. It's more common with darker skin colors, but it can happen with anybody, right? This is a result of overhealing, and it tends to be raised and often extends beyond the damaged area. So you'll see this person's hand, how you have the red raised area and then all that whiteness around it, right? It can cause mobility issues or restriction. It can cause pain sometimes. And then we have another type of scar that looks very similar to a keloid scar, which is your hypertrophic scar. Hypertrophic, sorry. This is similar, but it does not extend past the area of damage. So that's kind of the difference. And here's a little diagram here. See how the keloid is extending out, and the hypertrophic scar just kind of goes up where the scar was, right? Again, it could be painful, red. Usually it's from collagen imbalance. And it can cause excessive tension in the area too. So all scars can cause mobility issues and tension. All right, we have the striae scars. This is stretch marks. I just mumbled. This is stretch marks, right? It is formed when skin experiences a rapid growth, all right? That could be from childbearing. It could be from excessive fat gain, excessive muscle gain. So any excessive growth, right? It's usually a different color than surrounding skin. Could be white, red, whatever. This is when the stretched skin develops fibrous tissues to hold the expanding area together. So the skin is stretching too quickly and the body's like, we need to create extra tissue so that it doesn't tear. So that's what's happening here. Red flags. Remember, keloids can be painful. And contractures and actually all scars can limit some movement. This is where cross-fiber friction and myofascial release would be very, very beneficial, especially since myofascial releases can be a little more gentle. Contraindications. Avoid aggressive work on scars. Refer out if pain or restrictions worsen. All right. We only got a couple more slides.
Would you refer them to just like a regular doctor? Would they go to a dermatologist, or would they whoever they feel like they want to see, or
Whoever they feel like they want to see?
Well, yeah, but I mean, like,
Well, at this point, I feel like for dermatology, the issue has been healed. So I would maybe refer them to the doctor and they can find what's the best course of action. Honestly, if there's pain, just tell them to go to their primary. All right. They might branch out and send them to pain management if it's severe. But I don't know if dermatology would do anything else at this point. I don't know. I've never had an issue with a scar where I'm like, you need to go see your doctor. Unless it's like a new scar and it's inflamed and seems infectious. Infectious. But just,
well, I know with my leg, I went to a occupational therapist, and they did like, because it was more nerves than
yeah.
anything, and they did like this like desensitizing technique. And
Yeah.
stuff with different textures and stuff like that.
Ooh, probably weird.
It is weird.
Yeah.
Say it really.
So if it's nerve, obviously neurologist would take care of it too. Like if this is causing a lot of pain, they might send them to a neurologist, or pain management seems to be it. All right, pharmacology basics. Why do we need to know a little bit about medications? Because we need to know how it interacts with the body and affects massage. So important for massage safety. And we need to know bleeding, sedation, and sensory risks. This is fun. So if you don't know much about different medications, right? This is a cool little picture that tells you what the medication is and what it does, right? So let me see. A big one we need to know at the top is anticoagulants, because we need to know if they are on some type of blood thinner, right? Let me see. Antihistamines are a big one. Let me see here. Antibiotics. I mean, it's good to know if they're on an antibiotic and a laxative. No, just kidding. All right, a big one is also pain medication. All right, opioid. All right, high risk medication classes. So remember, red flags would be your blood thinners. It can increase bruising. All right, sedatives can affect alertness. Pain pills affect sensation and touch response. Some contraindications: avoid deep tissue massage if somebody is on a blood thinner. And then we also want to monitor dizziness and fatigue. I don't think fatigue is that big of an issue, but it is if they drove there themselves. All right. Drug reactions. Red flags would be adverse reactions are not side effects. All right, so side effects usually are temporary. I don't know why this is in here. I don't know why I put this in here. But anyhow, anaphylaxis is life-threatening. So pay attention to allergies with your clients. That's why I always make sure they don't have allergies to the products I'm using. Contraindications: stop the session if there's an allergic reaction. In our case, what we're probably going to do is either our lotion or our essential oil is going to cause this reaction. All right, that's why we make sure they're not allergic. If you happen to have a histamine response happening with what you put on your person, right, wash it off with soap and water ASAP. All right, get yourself a rag and excuse yourself. I've done that before where I'm like, you're allergic to oil that it's orange? You're allergic to orange? Yes. My head is tingly. I'm like, who is allergic to orange essential oil? There's people. It's usually one of the safe ones. We're going to learn that today. Some takeaways: always assess medications and conditions. Identify the red flags quickly. That's what this bingo is going to be for. If you're unsure, you need to modify or refer out. Alrighty.